Good morning, everyone, and welcome to today's webinar, Strengthening Families, hosted by the Resource Basket and Alaska After School Network. Today's webinar is part of our Supporting Youth webinar series. Due to some technological difficulties, this recording will be the first of two, and it will cover the first few slides of the presentation. And the following recording will be the original from the November 19th training, and picking up from where Shirley will leave off in this one. Before our presenter begins today, I just want to introduce myself. My name is Anna Long, and I will be your host for the training. I am the AmeriCorps Vista member with the Resource Basket. The Resource Basket is an online training and technical assistance center for those who work with or support rural Alaska Native youth. Our website, www.alaskanativeYouth.org, provides resources, opportunities for trainings, and funding, as well as uplifting stories of supporting youth. Points of view or opinions expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of OJJDP or the U.S. Department of Justice. So today our presenter is Shirley Pittz. Shirley is a private consultant with a master's degree in counseling from Creighton University. Till recently, she served as the Early Childhood Comprehensive Systems Program Manager in the Alaska Department of Health and Social Services and facilitated the Strengthening Families program. She practiced as a marriage and family therapist for several years and has worked in child abuse prevention programs and directed a variety of social service and education programs prior to her work with the state. Shirley is a UCLA Johnson & Johnson Fellow and a UMass Boston Napa Parent Infant Mental Health Postgraduate Fellow. She serves on the board of Alaska Association for Infant and Early Childhood Mental Health. Unfortunately, Kirsty was unable to join us today, but with working with Shirley with the Strengthening Families program, Shirley has offered to share with us a bit about what Kirsty has been doing in her community and her plans for the future.
Good morning, and thank you for having me. I'm always thrilled when I get an invitation to talk about strengthening families, and so I really appreciate this opportunity. So I wanted to start out this morning just giving you a little background around strengthening families and sort of how Alaska was engaged, and then just some foundational ideas. And then we can go in and talk a little at more length about the protective factors. So our opening slide has as a caption there, moving upstream by building protective factors. And we chose this picture of the fish moving upstream because it really kind of represents the Strengthening Families approach. What it is a very universal approach built on strength, and it's building and strengthening protective factors that families may have or need to develop, and by doing that we get ahead of the continuum versus waiting until families are struggling and having really severe problems and then intervening. So Alaska was chosen almost 11 years ago, probably 11 years ago, to become a Strengthening Families pilot state. And this was originally created, the approach was developed by the Center for the Study of Social Policy. And they were asked by the Doris Duke Foundation to really think about child abuse prevention in a new way. And part of that is because we didn't seem to be gaining much ground, numbers still staying very high in terms of the number of children who experience maltreatment. And so they were hoping for sort of an innovative new approach to this. They developed the approach, and then they recruited 7 states to sort of pilot this on the ground to see, does this make sense? Does it work? How do you do this? What does it cost? And it was the hope in creating this is that it would be a very systematic approach to strengthening families that could be implemented in multiple ways in many places. So to move ahead to the second slide, it was really kind of a paradigm shift when they created this approach. So where traditional child abuse prevention strategies had really been focused on targeting at-risk families or those families that were already experiencing significant difficulties, they wanted to go and have an approach that would embrace all families. That instead of these specialized interventions that really target at-risk families and focusing on reducing risk factors, that instead they would focus on the positive, on building protective factors. So when they started to think about this, they thought about where could we go, how could we approach this, and they decided to start with early care and learning programs. So child care, preschool programs, and in some cases Head Start programs. And part of that is they had decided they wanted to go where kids were already showing up and not have to create a new program, a new place for families to have to try to get to. They wanted to focus on all families, again, not those just that are at high risk, but recognizing that all families need support in the work that they do. And by doing that, it sort of removes the stigma. So no longer is it just for troubled families that we offer these things, but it's for all families because we need that. And by way of doing that, then we pull everybody into the fold. And they also wanted an approach that would be in operation before anything bad happened to kids. So how do we do that ahead of time and support families before really the stress mounts and bad things happen to kids? The other thing that was unique about this is focusing on outcomes, which everybody requires these days, was really in terms of measuring positive growth or increased protective factors for families. So really it was measuring can we build strength versus can we reduce risk. So some of their foundational ideas, let me back up and say when they originally started strengthening families, the first thing they did, of course, was went to the research to see what was showing good outcomes. And as they shook through the research, they discovered the protective factors, which I'm sure many of you have heard about. But that was nearly 12 years ago. So most recently, they have backed up. They have gone through all the research again to see have we learned anything new or things different. And they've produced a really nice report on their foundational ideas that you can access through the national website at the Center for the Study of Social Policy. And that website is available at the end of the slideshow, part 2. So just really quickly, the foundational ideas that Strengthening Families is built on is, number one, that it's a multi-generational approach. Most of us know that kids always return to families. Families are a key ingredient. So we know just focusing on children doesn't have the same benefit as if we can pull in family members and their parents. That might be grandparents, it might be aunties and uncles, it might be parents, but we do know that there is sort of this traditionally, I guess, a handing down, if you will, the way we practice, the way we parent, and our traditions. And so we need to incorporate all those generations as we do this work. Culture is, of course, a major consideration. This is sort of a universal approach that can apply in pretty much any culture. And it provides the recognition that how people do things and their beliefs and their practices really are very much influenced by their culture. So that needs to be considered as we do this sort of work. It's also a strength-based perspective, which we've already talked about a little bit. It's really focusing on the positive and enhancing what you see folks doing well. So sometimes when we do work with families, we tend to see all the things that aren't going well or all of the problems that need to be fixed, if you will. And this kind of flips that over and encourages us to really look at what are families doing well, what are their strengths that really can help them through some tough times, and how can we support that? It also looks at the biology of stress and recognizes the growth of that field. We know so much now about how stress or adverse childhood experiences impacts our biology. So our long-term health, how our own genetic, our genes are expressed, all of that is really influenced by the stress in our life. So there's recognition for the power of that and how we need to be aware of that. It also looks at resiliency theory, which again is what is resiliency, and we'll talk a little bit more about that. But it's the idea if we can help people and families become more resilient, obviously we have stronger families and better developing children. It focuses on well-being. So, for example, in child protection, for many years we have focused on safety and permanency, and we know that that's really not enough. So, what does it mean to have well-being, and what does it mean for people to be doing well and kids to be doing well? It's not just enough to be safe or have a permanent home, but really we should have the same sort of outcomes for all kids. And then they talk a little bit about the nature of risk and protective factors. It's the idea that there are some risk factors that you really just can't do anything about that. For example, teenage parents are at higher risk for stress in their families. But there's nothing we can do about the age of that parent. They're already a parent. But what we can do is focus on their strengths and the protective factors. And if we can support the positive and the growth of the protective factors, then we can help that parent do a better job. So it's a very positive approach. It's a very flexible approach. It's not a model. It's not prescriptive. So you can take the protective factors framework and really adapt it to any program that you work in, really any community or culture.